Preoperative fasting is a crucial element of the preoperative phase. Its purpose is to minimize the risk of aspiration due to the regurgitation of gastric contents once the anesthetic has been introduced. The role of perioperative nurse in relation to preoperative fasting is mainly patient assessment and education, as well as the education of the primary caregiver. First, the patient assessment will allow the nurse to gauge the level of understanding of the patient in regards to preoperative instructions. The patient's medical history will provide information on pre-existing conditions or medications that may require specific fasting instructions. It is the responsibility of the nurse to create a care plan tailored specifically to meet the needs of the patient and to deliver safe and appropriate care. Some patients may be more vulnerable to the effect of fasting, such as diabetics, where long periods of fasting may put them at risk for hypoglycemia. This can be corrected through carbohydrate-containing fluids. Next, older adults and children may generally need additional nutritional support because of the greater risk of malnutrition. Patient management should be determined based on each patient's condition as well as hospital protocols. Second, patient education is essential in developing trust and minimizing anxiety by giving them a sense of control, and in return, patients are more likely to cooperate in complying with pre- and post-operative instructions, resulting in better health outcomes. It is important to give clear and consistent information about the purpose of preoperative fasting and how the patient should go about it prior to surgery. Explaining on their level of understanding, as well as providing pamphlets, electronic education materials, charts, and whatever tools that are available and within hospital protocol to facilitate learning. Follow-up assessment must be done to ensure complete understanding and compliance of preoperative instructions. Upon admission, measures must be taken to maintain the fasting state, such as removing any food and drinks from the patient's bedside and placing a fasting sign on the bed to inform staff and visitors. As for children and adults unable to communicate, a sticker or vest may be used to signify that they are fasting. In conclusion, continuous assessment of the patient's health status must be done throughout the fasting state, and as an advocate for the patient, the nurse must ensure that the fasting state remains within the recommended times and guidelines in relation to the patient's specific case and health requirements to ensure the patient's safety.